Hello, my YouTube family. This is Simply Nadine. Um, the goal of this channel, of my channel, is to inspire, motivate, and hopefully you grow out of the information I put out there. And most of the information, if not all, will be my personal experience in certain topics that I'll be talking about on this channel. So most of it will be very simple, one step, and hopefully it helps or bless you in one way or another. So that's the goal. I've learned a lot using YouTube, so I figure why not also give back to this channel that has blessed me in different ways, if without even trying to count them. So I've learned a lot. So my goal at this point is, first of all, we're battling COVID-19 and everybody is asked to stay home, and the truth is it could be worse either way. And if you are safe, your family is safe, please don't take it for granted. Wash your hands like you're told to. Keep your distance when you're in public if you must go out there, and also help protect your family, you know. So until then, let's still stay safe. And this too will pass like everything else. And if you have been impacted in any way, I hope you find comfort one way or another, you know. We all have to do our best to stay safe and also to prevent others from getting infected. So, and once we could get to that treatment, then we will also forget this and look forward to something else. So stay safe, wash hands, keep them off your face, and we'll get through it. So let's move on to today's main topic, which is my experience with Isotretinoin, brand name like other people know it, Accutane, or my brand name, which is so hard for me to say. I don't know why, but without me breaking it apart, this is it. This is what I'm taking. So I have had, so what is Isotretinoin? First of all, it's a high concentrated dose of vitamin A, and it has side effects like most medicine, if not all, which I'm sure is all of them. It has its side effects, some worse than others, you know. So why did I decide to take this medicine? So I've had acne, chronic acne, for about 20 years. So I pretty much got used to having it on my face. It's been like part of me. So on my next video, I have like my one-step makeup, which I'll definitely be making a video on that. My one-step makeup. Can you imagine that as a one-step makeup? But that's a whole different video, okay? So I have my one-step makeup on right now because I have my daughter's birthday today. So I'll wash it off for the next video that I'm making in regard to my daily routine on my skin. So after 20 years of having acne, it's been a part of me. I normally don't do makeup. Those who know me know I really don't care what people think about my skin. I think I'm good because, I mean, I didn't make the acne. They just came up all by themselves. I did, diet-wise, I did what I could, cleaning my face and all that stuff. And I'm like, well, there are worser things to worry about. The acne, sometimes it's there. I don't even know it's there until I look at the mirror. So I've lived with it. It's been a part of me. So it hasn't really bothered me until maybe like last year. You know, we go through phases in life, and sometimes change is always part of it. So clearing my acne became part of it. So, and over the years, I also tried other medicine. I'm not very patient with some of them, so I didn't really finish them. So on some I did, and the acne came right back, which kind of did not give me confidence in trying many more chemicals. So I took a break off of taking pills and all just for acne and having to deal with all the side effects. So I decided to go on Accutane last year, 2019. So depending on the year you're watching this video, I started Accutane, Isotretinoin, or this brand name, in November of 2019. So I remember when I went to my gynecologist, funny. I went there for annual checkup and I was just whining about my acne. And she's like, well, because she knew I tried other things, which I had told her before, because I had side effects that I had to go to her for. She's like, oh, why don't you try Accutane? And well, I've heard good things about it, just like that. So I called my dermatologist, got my appointment set up for, it was October, set up in October, went in, and she said, well, you can't start till next month. So, but before you come in, you have to go do labs like 2 days before. So I did that 2 days before, went in, she checked. The main goal is you cannot be pregnant and your liver enzyme have to be at normal level, pretty much normal, because that's one of the organs that this medication will affect a lot. So, so mainly this information is for informational purposes. It should not be your main reason for why you're taking this medication. You should do your research, talk to your dermatologist, and you make the decision that is right for you. Disclaimer, okay? So personal choice is my choice that I decided to start on Accutane. So that's pretty much it, because it was that time of my life that I decided I wanted clearer skin, because I was moving into something else in life, and you start looking at things differently at some point in your life. And now I'll detail those in other videos. So so I got approved in November, started on my first package, which they started me on 40 milligrams. I don't remember the brand, but that one was once a day. And my dermatologist, she told me about the side effects, but she said, okay, just let me know whatever side effects you have, any change that you notice, let me know. So second month, lab result again, 2 days before. You cannot be pregnant. You cannot be pregnant. They cannot emphasize enough. This is how this thing looks like. It's pregnancy everywhere. You cannot. Don't even try it. I think it's upside down, but yeah. Well, that's it. You cannot be pregnant because it's that serious. You can have a defect. Your baby could have some birth defect. Well, it seems like it's guaranteed that if you get pregnant on this thing, your baby will not come out right. And nobody wants that. So definitely, you got to make the choice. Nobody wants a defective baby over a clear skin, per se. You can always take this another time after you're done having kids, or take the necessary precaution so you don't have to regret. Because I'm sure if you have a clearer skin and a defective baby, you will not be a happy person. So make wise choices before you start this. There's more to life other than clearer skin. I have, 3 kids? I think I'm done. I did the precautions. So make sure you're ready for this before you start. Ladies in particular, I don't know about the precaution for men, but that's what it is. You cannot get pregnant. You cannot. And every time you get this medicine, you have to do it. I pledge questionnaire. They check your knowledge on how much you understand, how severe this medication could be on a baby. And it's really serious. But yeah, I've taken it November, December, January, February, March, April, so going on 5 months. And I will attach pictures of my face, because pretty much this is the main place I always had acne. Funny, who knows, but I'll attach pictures so you guys, you watch it and you decide for yourself. My liver enzyme have been good since I started this medicine, and so far I'm good to go. Which is why I keep getting refills every month, and also pregnancy they check and check and check. No joke with this thing. Side effects I've had, right? I've had mainly, occasionally some headaches, not anything that not anything debilitating, right? I can still go about my day. Sometimes I'll take an ibuprofen and I'm fine. And it's not a daily thing, maybe once a week, once every 2 weeks, nothing crazy. Dryness. Occasionally I'll have like little patches, which I don't think anybody can see because I have my grease on, you know. I love grease. That's the only thing I use. I'm not I don't do layers of cream of this, cream of that. Simple. Nadine is simple. Simply Nadine, okay? So if you like simple, this is the channel for you. Little patch, and I put cream and it's gone. The other thing is my lip. Right now, I have some little pink lipstick on, which I'll wash it on my next video when I'm talking about my routine. And also, if you guys want to know about my hair, it's all mine. Dreads. Love it. Easy. Simple. That's it. So, and I'm doing fine so far. My face is looking good, and you know, I hope this blesses you. This encourages you if you wanted to start on Accutane. And remember, your side effects or my side effects will not be your side effects. So start it with an open mind, and don't how do I say it? Don't start looking for symptoms that are not there. Okay? Go a day at a time. If it works for you, good. If not, stop it. Do not go push it because you're trying to have clear skin, because the effects could be a lifetime effect, and so will the benefit if it works for you. Because from the information I read, it says the acne could come back a couple of years, or maybe not. Who knows? But day at a time, you know, because we can't really change the future. Really, we can't. So live it a day at a time. Enjoy the benefit you get from it if you do. If not, there are better things to worry about other than your face. You know, if people love you, they wouldn't care about your face. If anybody's worried about your face, girl, bye. Tell them you're not worth it. Personally, I have not. Well, if people have looked at me weird because of my acne, I don't know, and I really don't care. My life, my stages in life, my progress in life, I don't think my acne would change or would have or should have, could have changed anything. So, and I think I'm doing pretty well with my acne. Yes, I'm doing pretty well. Praise God. So, do your own research. Make sure you're comfortable with whatever comes with it, and be open-minded. Be flexible. One medication could work for one person and not for the other. So keep that in mind. But so far, so good. For my experience with this medicine. If you guys have any questions, leave comments down there, questions, and I'll answer as soon as possible. You know, you always have to have 2 forms of birth control with this thing. You always have to. And you always have to know them first, number 1 and number 2. And you always have to say the 2, 1 and 2, so consecutively, not 2 and 1 at one point. So keep that in mind. And what else can I tell you guys about it? Yeah, and then another side effect I have is joint pain. Nothing severe, still walking. I mean, today, well, I wore some heels today. Oh, man. Well, I could feel my knees, okay? But who cares? Better things to worry about than heels. So I'm not really a heel person. Occasionally, you try and look, you know. But my husband don't care about heels either, so we're good. So that's another thing to think about. You guys take care, stay safe. You know, we'll meet again. More videos, and leave your comments. Subscribe if you find this informational and you want more. Let me know. Click on the bell for notifications if you want notifications on my videos. I'm looking forward to a fun filled time with you guys, and I think I have a lot to give. You know, I read this post somewhere. I don't know who had that message. It says, what you give, you keep, and what you keep, you lose, you know. And for some reason, that quote right there has stayed in my head through college, university, my job, my professional life, and everything. So, and what better platform to give information that generations will benefit from than on YouTube. So, love you guys. Keep doing what you're doing. God bless. And also, remember to be kind, okay? Have a good one.